Hello, welcome to our presentation on workplace violence. You will hear recordings from our group members discussing a problematic issue facing our nurses today. According to the National Crime Victimization Survey, healthcare workers experience a 20% higher rate of violence than all other professions. The definition of workplace violence is defined by the National Institute for Occupation Safety and Health. It defines it as any physical assault, threatening behavior, or verbal abuse occurring in the work setting. The World Health Organization and the International Council of Nurses describe it as incidents where staff are abused, threatened, or assaulted in circumstances related to their work, including commuting to and from work, involving an explicit or implicit challenge to their health, safety, and well-being. In this table shown, there are types of workplace violence as defined by the National Institute for Occupation and Safety Health. Um, Types 2 and Types 3 are the most common in the healthcare industry. Examples of Type 2 are patients that are intoxicated and assault a nurse or a nurse's aide. An example of a Type 3 workplace violence incident includes bullying, which frequently manifests as verbal and emotional abuse that is unfair, offensive, or vindictive. It could also be any employee that physically attacks another employee, regardless of station.
I'm going to talk about statistics now. Most studies show that healthcare workers, particularly nurses, are at far higher risk of workplace violence compared to most other professions. For example, the healthcare and social service industries experience the highest rate of injuries caused by workplace violence and are 5 times as likely to suffer a workplace violence injury than workers overall. In 2018, workplace homicides in the private healthcare and social assistance industry accounted for 4% of total workplace homicides. From 2011 to 2018, there were 156 workplace homicides to private healthcare workers, averaging about 20 each year. In 2018, healthcare and social assistance workers overall had an incidence rate of 10.4 out of 10,000 full-time workers for injuries resulting from assaults and violent acts by other persons. An American Nurses Association study found that over a 3-year period from 2015 to 2018, 25% of registered nurses and nursing students reported being physically assaulted by a patient or a patient's family member, and about half reported being bullied. In the left upper corner of this slide, we can see a chart that is representation of the incidence rate of non-fatal workplace violence to healthcare workers in period from 2011 to 2018. And this is incidence rate per 10,000 full-time workers. We can clearly see how the numbers are increasing. 86% of healthcare workers have experienced or witnessed violence in the workplace. More than 50% believe workplace violence is a serious problem in the place where they work. 1 in 5 reported facing workplace violence at least once a week. 56% have suffered physical injury and 76% have suffered physiological injury. Nurses are reluctant to report violence from a patient for many reasons. For example, 23% fear retaliation, 25% are unsure how to report, 50% believe reporting will not prevent future assaults. Also, nurses are even more reluctant to report violence, bullying, or harassment from a coworker. 64% do not feel support from management, 66% fear retaliation, and 46% fear losing their job. All this information coming from the source Bureau of Labor Statistics 2018. This slide has a big chart on the top, and what the slide represents is violent injuries resulting in days away from work by cause. Vertically, we have nursing, psychiatric, and home health aides, like first category, second, registered nurses, and third, licensed, practical, and vocational nurses. Horizontally, we have numbers from 0 to 8,000. These are numbers of cases. And on the bottom, we have representation, what each color actually means. So, for example, light blue color represents number of cases of hitting, nigging, beating. Orange color represents injury by a physical contact with person while moving the person, meaning unintentional. Then dark blue represents injury by other person. Red color represents injury by physical contact while restraining the patient. And green represents intentional injury by other person. And all these numbers are coming from data source Bureau of Labor Statistics 2018. American Nurses Association's Code of Ethics for Nurses states that nurses are required to create an ethical environment and culture of civility and kindness, treating colleagues, co-workers, employees, students, and others with dignity and respect. Similarly, nurses must be afforded the same level of respect and dignity as others. On this slide, we have sources of violence. Possible sources of violence can be patients, visitors, co-workers, and other people. The data represented on this chart again comes from Bureau of Labor Statistics 2018 and is represented in percents. The American Nurses Association convened a professional issue panel to develop policy and identify strategies to address barriers to nurses and other healthcare workers reporting violence and abuse, and to strengthen zero-tolerance policies. This is underreported epidemic and has devastating results on the healthcare industry. The studies show that workplace violence can affect the quality of care, and care outcomes contribute to development of psychological conditions and reduce the RN's level of job satisfaction and organizational commitment. According to statistics, 1 out of 6 workplace deaths are from workplace violence. The Senate and House of Representatives of the United States of America in Congress assembled in 2019 Workplace Violence Prevention for Healthcare and Social Service Workers Act. Even if workplace violence doesn't result in death, it might lead to psychological distress, high risk of medication errors and patients' infections, temporary or permanent injury, impaired clinical judgment, poor performance, reduced level of job satisfaction, and it is costly. Most incidents of violence in healthcare go unreported for many reasons. There is perception that might be a part of the job, or not enough education that we should do that, how we should do that. Also, complex documentation procedures play important role and concern that violence happens so frequently and it is time consuming to report every event in addition to lack of response when time is taken to report it. Also, there is a fear that reporting will reflect poorly on the nurse, and at the end, there is belief that some patients cannot be held accountable for their violent actions, like cognitively impaired patients. In addition, according to data from Centers for Disease Control and Prevention, CDC 2021, 1 out of 4 employees will be victimized. 18,000 workplace assaults are logged weekly, and annual losses due to workplace assaults are $121 billion.
Let's take a look at what healthcare providers are responsible for and should do. We have to be familiar with the department policy regarding workplace violence. We have to promptly report actual or potential acts of violence to appropriate authorities. It is very important to emphasize the need to report threats of violence or actual violence and seek for help immediately. Workplace violence is not okay or normal behaviors. We have to cooperate fully in investigations of allegations. Nurses must document and report all allegations accordingly and comply with all further investigations. Managers and supervisors should investigate in a timely fashion and take necessary action to all acts of violence, stress, and destructive behaviors. Do not discard any report made and make them seriously. So, well, there is like the Workplace Violence Prevention for Healthcare and Social Service Workers Act. It was introduced by Senator Baldwin in 2015. House of Representatives approves Baldwin's reform to protect healthcare and social service workers from workplace violence. So workers have the right to refuse unsafe work if they have reasonable cause to believe it may pose an undue risk of injury to any person. So recognizing the level of violence and how to respond accordingly, it shows that potential or actual violence situations among nursing employees escalate when they are not diffused. So violence and warning signs can be identified in 3 levels. The 3 level is gonna be on the right side, level 1, 2, 3, and each level has signs and symptoms. The combination or any single level of signs may indicate potential violent situations. Employees need to make a judgmental call as to which appropriate actions need to be taken in evaluating the given situation. So there are several ways to respond to violences. So we can call 911 or other appropriate emergency contacts when it's really a urgent matter. We have to remain calm and contact supervisors, and we have to secure our personal safety first and then safety of others. We have to leave area if safety is at risk. And later on, we document the observed behaviors and we have to cooperate with law enforcement when they respond to situation.
Examples of workplace violence situations. There are some main themes of certain factors that can lead to violence in the workplace. One would be patient behavior, and some sub-themes to that would be cognitive impairment of the patient and the patient demanding to leave. An example of a violent situation that arose from a cognitively impaired patient comes from a registered nurse. I was sitting at the bedside of a confused patient. She had been laying down, got up quickly, and punched me in the left side of the face. An example of a patient demanding to leave, causing a violent situation, comes from a psychiatric social worker. Patient was at the nurse's station, demanding discharge, abruptly started striking at me, hitting and scratching my face and neck. There are also certain factors of patient care that can lead to a violent situation, such as any procedure involving needles, the patient being in any pain or discomfort, or physical transfers of the patient. An example of a violent situation that arose from a patient needing a procedure involving a needle comes from a nurse manager. While attempting to draw blood, the patient yanked her arm and attempted to bite the RN. The RN was stuck by the needle, trying to prevent herself from harm. An example of a violent situation coming from patient discomfort comes from a patient care associate. Employee was hooking up tube feeding. Patient got agitated and kicked employee in the face. Another example from a patient care associate would be I assisted the nurse with inserting an NG tube into a patient's nose, and the patient began fighting and kicking. I was bit and scratched in the forearm. An example of a violent situation from a physical transfer comes from a patient transporter. During transport, patient became agitated, jumped off the stretcher, proceeded to strike the employee. Employee tried to grab patient for her safety, and she scratched employee and broke skin. Patient fell on floor. At this time, nurse manager helped to transport. There are certain situational events that can also lead to violence, such as a patient being in restraint, a patient being transitioned, such as from post-op to recovery, or during hospital admission process, when anyone intervenes or tries to stop a patient from acting out or harming others, or when a patient needs to be redirected back into bed, back into a hospital room, something like that. So an example comes from a registered nurse of a violent situation coming from a patient needing to be restrained. Patient admitted with overdose. He was in 2-point restraints, became combative and verbally abusive to staff. While attempting to place patient in 4-point restraints, patient thrashing and hitting staff. RN number 1's left thumb was hyperextended. RN number 2's left forearm was hit with patient's head, resulting in pain contusion, and the PCA was punched in the arm. An example of a violent situation coming from a patient transition comes from a registered nurse. I was in operating room 3, waiting for the patient to wake from anesthesia. The patient woke and all of a sudden began violently kicking and pushing. In the process of restraining him from falling off the bed, he started kicking me in the chest. An example of a security officer intervening to prevent a violent situation led to a violent situation. Security officer was injured while attempting to control patient. Patient was disruptive and threatening medical staff. Security officer was kicked to the chest area by patient while attempting to place her in a wheelchair. And a violent situation that arose from trying to redirect the patient comes from a patient care associate. I was trying to keep the patient from leaving the room and going to the elevator by standing in front of her room door. She got mad and scratched my face. I grabbed her hands to keep her from scratching me again, and then she bit my thumb. What are the warning signs of workplace violence? Such things as unusual or changed behaviors, evidence of serious stress, continual excuses or placing blame, unshakable depression, evidence of possible drug alcohol abuse, safety issues, concentration problems, poor health and hygiene, inconsistent work patterns, excessive attendance absences, and decreased productivity. However, this may not be true in every case, since everyone handles situations like this differently. Their coping mechanisms may be affected by their life history, capacity to deal with difficult situations, and personal resilience. Preventing workplace violence. The strategy regarding prevention of violence in a workplace environment is the most essential component to an effective program. Becoming familiar with each facility department's policy and program regarding workplace violence is important. All managers and supervisors should be required to discuss the policy with employees so they have a better understanding on how to handle intimidating, threatening, and violent incidences, as well as understanding the consequences of such behaviors. The best prevention is to maintain an environment which minimizes negative feelings such as isolation, resentment, and hostility among employees. Keys to a successful violence prevention program needs to be designed specifically for the unique nature and varied needs of the organization and its residents. It requires the commitment of the employer, the workers, and the Joint Health and Safety Committee to violence prevention and the interventions that have been adopted. Maintaining open lines of communication and ensuring that every member of your organization clearly understands the scope of violence prevention is crucial to a program's success. A well-designed prevention program will minimize the potential for physical and psychological injuries to workers, provide clear roles and responsibilities for the employers, supervisors, and workers, improve residents' care and safety, and improve the quality of the work environment. Managing workplace violence. It's up to us. Nurses showing signs of stress or evidence of possible domestic violence should seek assistance immediately. First aid and emergency care should be readily available in case of an emergency. Healthcare facilities should have in-service learnings on how to manage potentially violent situations. How we can help decrease violence in the workplace. Always treat others with respect, choose our words and actions carefully, and communicate clearly and appropriately to others. Avoid gossip and spreading rumors. Rely only on the facts when communicating. Collaborate and share information when appropriate, accept help, and refuse help from others gracefully. Take responsibility for your actions. Do not abuse our power as nurses. Demonstrate openness to other points of views, experiences, and ideas that are not our own. Apologize when necessary. Encourage, support, and mentor others. And most importantly, always uphold the nursing code of ethics.
Thank you for watching this video, and I wish this video helps you to be more safe at work. Have a nice day.